So this is a patient who's having very limited mouth opening. This is after cancer surgery. So basically, she's won this battle over cancer. She's having a few issues. आप देख पाएंगे, you can see the teeth are in very bad shape. That's the mouth opening she has. That's it. So we're going to be working on both the joints from inside the mouth, also using two flaps from the top of the face, swish it around inside and go all the way up to the uvula. That is the palatal aspect. So by doing this, we're going to get some fresh tissue there. We're going to relieve the issue with the joint, thereby enable her to open the mouth. Once that happens on the table itself, we're going to clear the teeth that are useless, that are now destroyed, and then they're going to be planning implants, if possible, at the same time or later on. So the main process today is going to be mouth opening. Anesthesia is also very challenging because she doesn't have adequate mouth opening. So we're going to be doing a fiber optic. Our team is going to be doing a fiber optic intubation. Okay, madam.
Today is post-op day 1 of a bilateral nasolabial flap that we had done.
Okay. Okay. Oh my God. Okay.
So today is post-op day 2. ये ऊपर कर दीजिए.
Generally, after 4 weeks, I will do the small division.
Usually we can wait for a couple of more weeks for her. Because it's still very firm when I touch it. It's not become soft. You get it for some more time because post radiotherapy and post all these cancer surgeries, healing could be little.
Yeah, she's not been doing it.
We can start that today. It's a little bit more aggressive mouth opening, and let's I think probably plan by month end. So 2 weeks will go by. Then it's just one day you have to be here. That's all. You come in the morning and by night you can go home.
So you're talking about this, doctor?
Correct.
Okay.
So this is from here. It's going inside. Then I will divide it and put it inside.
Okay.
It's healed. Inside is healed quite well. Outside is not healed that much. So then let it heal. Like 2 more weeks extra I'm giving. Generally after a month we would do, but for a little slow. It's okay. Also because of the general health, age and multiple things.
How is the tongue, doctor?
Tongue I have not done much. We've just released a little bit
The tie was
from the front. It is free, but I think I don't see a similar improvement in her speech. There is a physical improvement you can see in the tongue, about 1 centimeter, but it is not translating to improvement in speech. So that is because of the fibrosis, and sometimes we need speech therapy, some help for the speech. So we can start the speech therapy also a little bit, but I thought once you divide, fix it, then we can do.
Yeah.
Maybe after a month or 2 or something like that.
And the mouth closing, doctor, that will close after like it heals entirely.
Yeah.
Is it okay?
It will close to you.
And that will become thinner and thinner. The cheek.
The cheek things.
Yeah.
She's been complaining it's heavy, like it's pulling down something. She's worried with that. But
Tight.
weight, and she feels the weight and the tightness.
Yeah. The tightness settles down and becomes normal. It is for that tightness only I'm not doing the surgery now. Same reason. What she feels tight is what I'm saying indurated or hard. In medical terms, indurated. So yeah, it's the same thing. That's because the healing is not problematic, not complete. Heaviness, we can't solve that because see, tissue from here is sitting inside. No? It will be little heavy. Usually patients get heavy. They get used with that. We can reduce that inside also later on if it's too much of a problem. I don't think she will have that issue once it heals. I think that should settle down.